involved with an issue that I was interested in that was affecting people's lives, and kind of as a community service type of effort as well, used my background in pharmacy education to help make simple analogies for people like I do for students to help understand maybe more difficult concepts like pharmacology or neuropharmacology. Since most of my students are constantly on Facebook and their internet and things like that, I'm going to try to make this at least a little bit engaging and do what I do with them, which is include some fun facts about the science. So that's kind of how I'm going to start this. And then I want to address some concerns that you all may have. So I'm just going to start by throwing out a handful of drugs like aspirin, metformin, warfarin, Taxol, maybe ACE inhibitors like lisinopril. Maybe a lot of people out here in the audience even take some of those medications. And what those all have in common is, one, they're some of our best drugs that we have for patients, and two, they all have origins in plants originally. A large amount of our pharmacopoeia comes from plant-based medicines. They seem to have a long track record and do quite well. And so that's what we're talking about here today, is the potential for cannabis, a plant, to be medicinal. Interestingly, we're talking about the therapeutic effects of it, and a lot has been known for some time. In fact, the first recorded use of cannabis therapeutically was 2737 BC. The United States Pharmacopoeia included medical cannabis from 1846 until 1942, even after it was made illegal in 1937. So there's a long-standing history from that. Not only that, just to fast forward to this year, our neighbors to the right, Illinois, to the east I should say, they just approved medical cannabis in 2014. So we have about 4,000 years of data that supports its use as a medicine. But what's been uncovered in the 90s is really what I want to speak about today, and I think that's some of the stuff you'll find enlightening. In our bodies, we actually have an endogenous system called the endocannabinoid system, named so because we have receptors that are specific for the compounds within the cannabis plant. And believe it or not, our body actually produces two compounds that are identical to those that are in the cannabis plant. They are called anandamide, and they are called 2-AG. Interestingly, here's a fun fact if I've lost you, anandamide was named so because ananda is the Sanskrit word for bliss, and it was thought to be a blissful thing, sort of the THC look-alike molecule. So in our body, these things are taking care in a homeostatic fashion, maintaining balance within our system at all times endogenously. Now, for some unfortunate people that have severe epilepsy, the amount of endogenous production of these cannabinoids is simply not enough to overcome the seizures and the seizure threshold that's been lowered. And so by using medicinal cannabis, they are able to take exogenous or cannabinoids from outside the body and put them into the patient's body by alternative ways. There's more than ways to get the cannabinoids in the system besides just smoking. I want to make that clear. And those cannabinoids take action on this natural endogenous system within our bodies, and that is where these therapeutic effects are coming out. This system was discovered in the 90s in Israel, and cannabis is part of active chemotherapy treatment in Israel as well as Spain. So I'm here to really just to speak and enlighten you more about some of the fun facts that you may not be aware of. So along with the endogenous system, I just wanted to also speak to an analogy of Prozac. Just like serotonin is something that used in our body that regulates our appetite, our sleep, our mood, our feelings, so do these endogenous cannabinoids. And just like we have Prozac that is used for people that don't have enough serotonin to increase that, we can use these exogenous cannabinoids. So I think there are clear analogies. One last analogy is with the pain syndrome. I'd like to talk about when you all run for a long time. I'm sure you do that occasionally. It's tough to stay up on the exercise, but your legs start to feel heavy and then your endorphins kick in. That's another analogy of an endogenous system that comes into play. We recognize that sometimes those endorphins are not enough to cover patients for their post-surgical pain, so we give them opioids to act on that system. So these are analogous things, in my opinion, from a scientific perspective to what we're talking about with medical cannabis. And so lastly, I really want to speak to what we're talking about today, which is medical cannabis, not recreational program. We're talking about a small subset of patients with debilitating diseases. And so I really would like to address concerns that anybody may have that are outside of whether we are going to lead to worse things. And lastly, in regard to pain, just to put in perspective alternative treatments, as you guys are fully aware, there's an opioid pain epidemic out there right now. One of the potential benefits of medical cannabis is for pain. To give you a statistic to put this in perspective, in 1997, there was enough opioids dispensed for everybody to have 100 milligrams. In 2007, that increased to every adult American in the United States having an allotment of 700 milligrams. which is the equivalent of 1 Vicodin for every adult American for 1 month straight, round the clock. So opioids and their use in the pain syndromes is a much, much bigger problem, and potentially by acknowledging the use of medical cannabis for pain, we can indirectly curtail some other problems that are related to this field. So thank you for your time.
Thank you, Professor. I know that we've got some senators that want to ask questions, and I just wanted to acknowledge that Senator Reagan, Senator Brace, and Senator Hart